Did you know it requires the coordination and proper function of 6 cranial nerves and 26 muscles for a child to use their mouth correctly in order to feed? In fact, the tongue alone is made up of 8 different muscles. The benefits of breastfeeding for achieving long-term health have been widely researched and documented. However, the road to successful breastfeeding is not always easy and can be littered with lots of misinformation. The Board Certified Lactation Consultants at Milk Diva believe in an integrative and collaborative approach in order to achieve long-term optimal oral function. Let's begin to untie the knotted topic of tongue and lip ties, also known as oral restrictions. Let's start off with a few facts. One of the first documented cases of tongue tie is found in Mark chapter 7, verse 35 of the Bible. Research shows that the prevalence of tongue or lip tie occurs in up to 10% of the population, and more recent research indicates that the prevalence may be even higher. Tongue or lip ties cannot be diagnosed with merely a picture or a quick look. A full functional and structural evaluation is required to make an appropriate diagnosis. One of the biggest misunderstandings about frenectomies, the procedure that is done to release the tie, is that the procedure alone is enough to fix a baby with a tongue or lip tie. For optimal outcomes, a team approach is critical. Most people have a thin piece of tissue under their tongue or above their gum line called a frenulum. A tongue or lip tie occurs when the frenulum is restricted or tight and interferes with effective function. When breastfeeding, a restricted frenulum, also known as a tongue or lip tie, can cause symptoms for both the mother and the baby. Some of the symptoms for the mother are painful nursing, creased or flattened nipples, nipple damage, incomplete breast drainage, recurrent plugged ducts or mastitis, the inability to nurse without a nipple shield, and decreased milk supply. Some of the symptoms for the baby are poor latch, poor weight gain, clicking or smacking noises when eating, dribbling milk out of the mouth, inability to hold a pacifier, mouth breathing, and problems with bottle feeding. It may come as a surprise, but tongue tie education is not part of the standard curriculum for lactation consultants, dentists, pediatricians, occupational therapists, or speech-language pathologists. The best way to find out if a baby has a tongue or lip tie is to have the baby evaluated by a provider who has specialized training in oral restrictions. A full functional and structural oral assessment is required to diagnose an oral restriction. A functional assessment for a baby can be performed by a specially trained international board-certified lactation consultant or speech-language pathologist. A structural assessment can be performed by a specially trained dentist, an ear, nose, and throat doctor, or pediatrician.